Welcome back! If you've made it this far, then you've already learned the purpose of this video series and you've learned a little bit about what unconscious bias is. In this video, I want to provide you with a practical example of unconscious bias in medicine and how it can negatively affect patients by causing a delay in care. So I had a family member who had a dental surgery that was going to require a tooth extraction. And like any other provider, the provider of the surgery called in the medication that they felt was appropriate for my family member's post-op healing process. So the surgery went successfully. My family member went to the pharmacy to pick up the medication, but they realized that the provider simply called in Tylenol 500 milligrams, which is an over-the-counter analgesic that we commonly use for everyday pain such as headaches. The family member took the medication as prescribed, but realized it was not resolving their pain. And their pain got so bad that they had to call another family member to drive them to the ER to see another provider to get some assistance with obtaining a better medication that could alleviate their pain. Well, this ER provider saw them, and instead they gave them an opioid. They gave them hydrocodone acetaminophen as the medication. And my family member found that this medication was much more appropriate because they instantly felt relief from the pain. But sadly, they racked up an extra bill, an emergency room bill. Now, as many of you may know, many providers call in medications all the time for their patients for the post-operative healing process, and many providers call in opioids because they're already anticipating that their patient is going to be in pain and that the opioid will be strong enough and not an over-the-counter medication such as Tylenol. So my question for you is, why did one provider feel that an opioid would be strong enough and the other one did not? And sadly, this is very common. Studies have shown that inequities do exist amongst races and who gets opioids and who doesn't. And like my family member in this example, this delays care, and it can also lead to unnecessary medical bills and having to go back to other providers to get second and third opinions. And I just wanted to share this example because we are taught in school to use our professional judgment. Many healthcare providers are taught to use their professional judgment, but we do have to look at ourselves objectively to ensure that our professional judgment is not being tainted by our unconscious biases. Stay tuned to hear Janan's story in the next video.
Once when my daughter was sick, I made an appointment for a clinic with a provider. When the doctor came in to see us, he asked if he'd seen her before, and I replied that we did prior to the pandemic. Confirming the chart, he saw that we had not visited for 2 years. He shared the importance of seeing a primary care provider, and I agreed. During the pandemic, my spouse and I used our best judgment as pharmacists to judge when to take them in. I don't think he heard me because he said, "Patients like you always do this. You only come to me when your child is sick." As I started to reassure him that we wanted to become patients in his practice as a whole family, he stopped me and said it didn't matter that I was a pharmacist, and repeated how people often take advantage of him without establishing care. I felt uncomfortable at that time, and I asked, what should I do? He left the room, and to my surprise, when he returned, he brought my copay in cash and told me I was free to go elsewhere for care. I was stunned, hurt, and I felt unwelcome, not sure what to do for my sick daughter. We had scheduled an appointment with him because she needed his care. So I went to the next best thing, urgent care, where they listened to her lungs, listened to me, ordered a chest x-ray, and discovered she actually had a deep pneumonia. My daughter had the right to be seen as a patient at this practice. During the pandemic, like many parents, I didn't go to all my routine appointments, and I feel I faced a bias. Check out additional videos from Morgan, Jones, and I that uncover more about these biases, what they are, and what to do if you're a provider. Thank you.